under pressure already.
Is your pain okay at the minute?
Everyone expected a tough winter for the NHS, but figures show this year symptoms of real strain were showing in September. A&E departments, the 111 phone service, even cancer treatment, all failing to keep up. In here could be the difference between creaking and crisis. But this GP isn't alone in having a full fridge of flu vaccines. Surgeries in England are on average giving 100 fewer jabs than last year. Vulnerable people going into winter unvaccinated are a worry.
We're already getting alerts to say that hospitals are full and can't cope. If you throw in a flu epidemic as well, those patients who are very at risk of complications, like people with heart disease or lung disease, are going to fill up even more beds in those hospitals and put those hospitals under even more pressure.
Data for September showed a host of missed targets. Ambulances failed to get to 75% of serious 999 calls in 8 minutes. The 111 phone service didn't answer 90% of its calls within 60 seconds. A key cancer measure to start treatment within 62 days. That's being missed too. And A&E units missed their 4-hour target for the 12th time in 13 months. Hospitals often show symptoms when other parts of the NHS have the problem. And in September, 5,000 patients were stuck in beds they didn't need because social care wasn't in place. All of this just as junior doctors are considering industrial action. NHS England say they're treating record numbers of patients. They started planning earlier and are coping well given the context. The Shadow Health Secretary said today that context is the most difficult winter for 30 years. Dominic Reynolds, 5 News.